Do you have a smaller probe or a thinner? Okay, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment. And we're just getting our first look back here. The meniscus so far on this medial side looks pretty good. And we've got a probe in here. We can use this probe to feel the meniscus. We're just trying to focus the camera a little bit better. Okay, so that looks pretty good. The articular surfaces look pretty good also, so that's encouraging on this medial side. Meniscus here is good. All the way back to the posterior horn. Of course, we had a good MRI scan showing that this was most likely not injured. And it appears to be checking out under direct visualization here. So that looks good. We'll keep looking here. If there's anything else to show you, we will. Medial compartment's checking out pretty good. Okay, so now we're looking at the anterior cruciate ligament. This is in the middle of the knee, and this structure looks pretty good. Your ACL looks like it's coming off the tibia like it's supposed to down here. And then we can track it up as it inserts back through the notch. I'm going to rotate the camera and we can see how it heads back up in this direction. And that looks good. So next we'll look in the patellofemoral joint. Okay, so this is your patella at the top of the screen. The medial facet is over here on the left. Lateral facet's on the right. Trochlea is in the middle, and this looks good. We can follow it all the way down to the front of the knee, and the cartilage looks great. No signs of any significant problems in the suprapatellar recess. We didn't see any loose bodies. When we look down here in the lateral gutter, that all looks good. And so now we can finally have a look in the lateral compartment. Pause. Okay, so we're looking in the pump controller. We're looking in the lateral compartment at this meniscus tear. And what we're seeing is that the posterior horn here looks good. We come around to the right to the popliteal hiatus. There's the popliteus tendon back there. This is an area where the meniscus is not attached at the periphery. And here's where the tear starts, right at the tip of that probe. And the issue is that you can see the periphery of the meniscus is still intact here. At least it looks to be as I probe it and feel it. But you've got this very distinct tear here and a part of the meniscus that's typically avascular, doesn't get a blood supply, and more importantly, is too small to hold a stitch. That's only 2 millimeters right there. So we're talking about a small tear. In other words, trying to put one stitch in that little piece ends up making this likely worse. So what we're going to do is just nibble at this meniscus so that we don't take any more than we have to. And if there's anything left to repair after that, we will. You can kind of see what's happening here. It's starting to look better. Push, straighten the knee just a little bit, Okay, and then push down with your right hand. Left hand, sorry, yeah. So that's starting to look a little bit better. But it looks like we may want to put a suture in here because of the way it's split at the periphery there. So we could put a suture in here and one above, potentially, or we could do a side to side. We're going to explore this a little bit more before we decide what to do. Okay, you can see here we've got an instrument in that allows us to use a suture to try and repair this split that does extend back to the capsule here. And so the first step is to deploy the lower jaw. We'll do that and show you some more in just a minute. Okay, so here's where we're at. We've tried to put in that side-to-side stitch to secure that. You can see how that was split there, right at the popliteal hiatus. We're still going to inject a little bit of our PRP, I should say your PRP, to try and promote a healing response right through there. So we'll show you some more in just a minute. Okay, so here's the needle coming in for the PRP, and we're going to go ahead and inject right through there.